The second area I would encourage you to look at, particularly during orientation, are what are the services and programs that are available to you from the community healthcare providers, and how do those programs and services that they provide meet your special needs that you have with the chronic illness that you are addressing. At many institutions, because of the size of the student population, there is going to be a whole host of resources for healthcare that are addressed specifically to students and other members of the campus community. So while you're at orientation, oftentimes those services will be present at orientation in some of the activity fairs or resource fairs. Look for those resources. But if you don't see them during orientation, again, take another day, and while you're learning the campus, learn the community and identify those healthcare providers that you will need in order to be successful at school. The more time you put up front before you enroll, making sure that you've identified the physician or care group, make sure that you've identified whether your insurance is going to be covered or accepted there, make sure that you've identified how you're going to get to them based on their proximity, the more you'll be successful. You need to also have a plan that you've talked about with your family for how you're going to access those health care providers, either for maintenance or if you have an emergency that needs immediate attention. Again, the proximity is going to come into play here. So if the service is immediately available to you, then that's great. But if it's not, if it's 2 hours away, then you need to have a plan for how you're going to get there for maintenance or an emergency. Once you've developed that plan and you and your family are comfortable with that plan, then you need to share that with the appropriate people. If you live on campus, you need to share it with your RA and the housing officials that you live at. You should already be doing that because you've already asked for an accommodation if you had one earlier, and that would be part of the accommodation that you would receive. University housing or residence life would be prepared for that. Or if you live off campus, make sure that your roommates living in the same apartment with you or friends adjacent to you know of your special needs. And so if an emergency arises, or if there's a maintenance issue that arises, they're prepared to assist you with that. So be sure you've identified the resources in the community, have a plan, and make sure that you're ready, that you're comfortable with that, and the appropriate people know about that.